Good Monday evening and welcome into the news at 6 on WRTV. I'm Amanda Starantino.
And I'm Mark Mullins. First tonight, the COVID crisis still has a strong grip on Indiana. The State Department of Health confirms 5,218 additional cases of coronavirus. That is the lowest number of cases reported in a single day since Wednesday of last week. But keep in mind, Monday numbers are usually lower because of a lack of reporting over the weekend. A total of 256,744 Hoosiers have been diagnosed with COVID-19 since the pandemic began in March. The state also reports 26 additional deaths. In total so far, 4,686 Hoosiers have died with coronavirus.
A COVID-19 data expert calls Indiana's latest case and hospitalization numbers frightening. WRTV reporter Kara Kenny finds out what the increase in COVID-19 cases means and what can be done to address it.
My job really is to track diseases.
Dr. Brian Dixon is the director of public health informatics at the Regenstrief Institute in Indianapolis, which helps advise state health officials. For the past few days, Indiana has reported more than 6,000 cases a day of COVID-19.
The numbers that we are seeing most recently on the state's dashboard and the Regenstrief dashboard are frightening. This trend in new cases really began back in late September and have just carried through till now. So we've seen no signs of decline over the last several weeks. And Indiana, along with other states in the Midwest and of course the U.S. as a whole, is on what many are calling an exponential growth path, which means if we don't act, then we will continue to see numbers go even higher.
Dr. Dixon is also a professor with the IU Fairbanks School of Public Health. He says the increase in cases is not a result of increased testing.
The number of cases we're finding is outpacing the volume of increases of testing that we're doing. So that's where the positivity number comes into play. We're seeing positivity well over 10%, and we're seeing positivity increase about 1% every few days. And that means that there's a lot more cases out in the community, and there's a high level of community spread happening. And it's happening in almost every county of the state. So this tells us that the virus is just sort of running rampant through the population.
Dixon estimates in a room of 10 people, up to 2 of them are likely to have the virus or have already had it.
So if you're having a get-together of, say, 20 or 30 people at your house, then there's likely about half a dozen of them that have the virus. And so it's really important. We're really encouraging people to have smaller gatherings.
Hospitalizations are also at record levels, and some facilities are already hitting their breaking point. Dr. Dixon says state leaders need to consider restrictions that will make an impact on rising numbers, especially on activities involving eating, drinking, and not wearing masks.
I think our leaders should really think about some of these strategies, not to, close businesses. No one wants to see a business closed and shut down permanently, but really put some restrictions in place to help people make the right choice over this holiday season.
Working for you, Kara Kenny, WRTV.
Dr. Dixon says asymptomatic people play a role because many of them never get tested because they don't feel sick and they're not traced back to someone who tests positive. He says you can do your part by wearing a mask and social distancing when possible. The numbers show the virus is spreading when people gather together without wearing masks.